Hello, and welcome to Telehealth. Telehealth uses telecommunication technologies such as video conferencing, streaming media, store and forward imaging, and land-based and wireless communications to allow patients access to care that they might not otherwise be able to obtain. The terms telehealth and telemedicine are often used interchangeably, but according to the Health Resources Administration, telehealth is much broader and can encompass health-related education, public health, and health administration. Telehealth is not meant to replace all provider face-to-face visits, but it can be used to help manage patients with chronic physical and mental disorders, particularly those who live in rural areas where access to specialists is limited or requires travel. In many states, reimbursement for telehealth visits is the same as that for in-person visits. This makes telehealth an attractive and cost-effective option for both patients and providers. Patients still must see a provider in person, and there are limits on the number of telehealth visits that insurance will pay for. However, not all states have agreed to pay for telehealth services in the same way. For example, Texas and Arizona are more restrictive in the reimbursement and the use of telehealth services. Research on the effectiveness of telehealth has found evidence to support its use in patients with chronic conditions and with those receiving psychotherapy as part of behavioral health. In particular, improvement in outcomes such as mortality, quality of life, and reductions in admissions were seen in patients who were followed with chronic diseases. Benefits of telehealth include access to health care is increased. Patients in rural areas can reduce the need to travel, and they receive access to specialists that may not be available in their community. Health outcomes are improved. Increased access to care can reduce complications and increase diagnostic and treatment options from specialists. Healthcare costs can be reduced. The expenses involved in frequent long-distance travel are reduced or eliminated, and home monitoring of chronic conditions can help reduce hospital admissions. Telehealth may help with shortages of healthcare providers. Many new graduates are not willing to move to rural communities. Telehealth can give patients access to primary care providers and specialists from other areas. A 2016 survey by the American Telemedicine Association found that approximately 15 million Americans had received some type of medical care remotely in the past year. In addition, the American Telemedicine Association surveyed 280 healthcare executives and found that 72% of hospitals and 52% of physician groups use some kind of telemedicine program. Some barriers to patient participation and telehealth use. Some patients may be reluctant to use telehealth services because their insurance company may not cover the cost. Older adults who lack understanding of or experience with technology may be reluctant to use telehealth services. The lack of availability of broadband internet services throughout the country also limits participation. In addition, many patients are not aware that these services exist or that their healthcare provider is willing to participate in this type of interaction. On the provider side, reimbursement challenges still exist and vary from state to state. Obtaining a license to practice across state lines varies by some states. Some offer a special telehealth license and allow providers to practice in bordering states. Geographic Information Systems. A geographic information system, often referred to as a GIS, uses location to capture, manage, and analyze data. This technology has been used both inside and outside of healthcare. It relies on satellite imaging and the Global Positioning System, GPS, to capture geographic data. Those data are then managed and stored on a database. Healthcare policymakers, researchers, and public health professionals use GIS to understand a health problem, decide the best response to that problem, and plan ways to avoid the same or similar problem and keep it from occurring again. Currently, GIS is being used to identify health trends. This combines individuals' health data from electronic records, data from wearables, and data from their environment to determine if there are clusters of cancer in an area or obesity related to certain areas or climates. Track the spread of infectious disease. Data is used to map where diseases are most likely to spread next and gain an understanding of vaccination rates. Use personal technology. Data from wearable technologies has the ability to determine trends in heart rate and sleeping patterns of individuals and to determine if that varies in different geographic areas. And lastly, incorporate social media. Through the use of social media, researchers are able to query posts or tweets for keywords such as flu or influenza to create a visual map on where the flu outbreaks are geographically located. Public health nurses and administrators can use GIS to track where chronic disease programs should be placed, to monitor the effectiveness of these programs, to plan new treatment facilities, and to track acute health problems, among many other uses. GIS gives healthcare providers the tools to show where services are provided and where health services are needed. Gaps between available programs and the needs of the community can be identified easily. Active learning scenario. Telehealth is increasing in popularity, especially during the COVID-19 pandemic. A quick search on Hack's Library or Google Scholar will allow you to locate various methods that telehealth is being utilized. Have you personally experienced telehealth with you, a friend, a family? What were your thoughts? How do you envision this process evolving in the future of medicine? Weekly reading assignments are listed below. Please let me know if you have any questions or concerns. Thank you.